In today's video, I'm going to be sharing my favorite exercises that I use with my patients to overcome low back pain during pregnancy, and most specifically, SI joint pain, which is on the back of the pelvis here, along where the side of the pelvis and your sacrum meet. This is a really common area of pain and discomfort, especially during pregnancy, that is often due to a muscle imbalance of the muscles on the right side of the pelvis compared to the left. And often there is a rotation that is occurring that is creating compression and discomfort at that area. So the exercises we're going to be going over are to help restore more balance across these muscles and therefore give more space to your SI joint. So a few props you're going to want to have on hand are a medium dumbbell. I'm going to be using a 10-pounder, a ball, or if you don't have one, you can use a foam roller or a towel roll. And then I'm also going to be using these yoga blocks as a stool for the last exercise. So feel free to improvise with some books or a stool, or if you don't have yoga blocks. And I'm going to be using a chair as well for some balance. So let's go ahead and get started on our back. We're going to begin using our ball. And I'm going to be placing my feet on this bench here. You can use your chair. And my ball is going to go between my knees. So I have about a 90-degree angle here with my knees and approximately a 90-degree angle here with my hips. So I want you to press your heels straight down into your chair, and then you're going to scoop your pelvis just a little bit up off of the mat. So I still feel my spine, but my pelvis is elevated. You're going to hold this position for the movement. Now you should start to feel some of the work on the back of your legs, your hamstrings, helping to scoop that pelvis and keep it in that position. Now we are going to glide your right femur down towards the floor as you reach your left femur up. And there is this sort of twist of our pelvis. Now we're going to slowly glide the opposite direction, keeping that little bit of that tuck of the pelvis, so we're not lifting up or lowering down, but we're just getting this rotation to happen. As I rotate and have my left leg longer than my right, you should really feel your left hamstring working and your right leg relaxing. As you switch, now my right leg is lengthening and I really feel that right hamstring activated and my inner thighs hugging around the ball as well. My left leg is relaxed. So this rotation is what we need to do in real life for walking. And often when we have SI joint discomfort, one of these directions will be especially limited. So if you notice that on yourself, that's good feedback of which hamstring we need to work on more. And getting this coordination down will help with that. One more time. Then you're going to come parallel with both legs being at the same height and slowly lower your body down. Exercise number 2, we're actually starting in this same position, so you're already ready to go. From here, we're now going to focus on that hamstring activation. So I want you to squeeze that ball with about 50% effort. Keep that energy. You're going to press your feet into the bench as you scoop your pelvis, and you're going to lift up into what I call a hamstring bridge. Lift up just as high as you can without losing that tuck of your pelvis. When you get to that height, then you're going to hold there for a moment, slowly lower back down, vertebrae by vertebrae, trying not to lose that tuck until you reach the pelvis back down to the mat. Release that pelvis so it becomes parallel with the floor, then reconnect. So we inhale to prepare, exhale, think about your belt buckle tipping towards your nose using your lower abdominals. Keep that energy of your belt buckle going as you slowly roll up. Keep that squeeze on the ball. Keep your heels pressing into the bench. Then you're going to lower down piece by piece, keeping that belt buckle towards your nose, slowly lowering down, and then release to the floor. Again, we're going to exhale to scoop. Slowly articulate your spine upward. Find your hamstrings, find your core, and then taking that breath back in as you slowly lower all the way down. Nice job. From here, we're going to come onto our side. I'm going to trade my ball for a yoga block. And we're going to come into a version of a Copenhagen side plank. So here I have a block underneath my top leg, and this top leg is bent at a 90-degree angle, and I have my 90-degree angle of my front leg. My elbow here is directly underneath my shoulder. I'm pressing actively up out of the floor to activate my obliques and my lats on this side. Now I'm going to press this top leg into the block to feel my inner thigh connect. Now I'm going to inhale to prepare, exhale, hug baby, and you're going to lift your knee up here to feel your inner thigh connection build with your lower abdominals. Then you're going to inhale to lower that leg back down to the mat and release the press into the block. Reconnect again. We press, inhale to prepare, exhale to connect, lower abdominals upward with that hugging of baby. As you bring that leg up, check in that you're not leaning back or rolling back in order for that leg to come up. That's a common compensatory movement. So keep your body stacked as you lift. Slowly lower that leg back down. Keep going with your breath. Inhale to prepare, exhale. And if this is feeling particularly easy for you, then you can also challenge it by lifting that foot all the way up off of the floor as another option. Again, inhale to prepare, pressing that leg into the block. Exhale. Inhale to lower it back down. And we'll go ahead and switch sides. As you're setting yourself up, check in that this top leg is not too far in front. We want it to be parallel with your rib cage and the rest of your spine. So again, we have our elbow directly underneath our shoulder, 90-degree angle with both legs. You're gonna press that top leg down into the block. Inhale to prepare, exhale, connect with your abdominals as you float that knee up off of the floor. Hold that there, make sure that we also don't drop with our rib cage as we pull that leg up. Keep that connection into the floor with your elbow. Inhale to lower that leg back down. Inhale again, exhale, keep that energy pressing into the block. Hug baby as you float that knee up. Hold there. Inhale to slowly lower back down. Again, option here, if this particular knee lift is not feeling that challenging, you can add that full leg lift here as another option. Continue with your breath, really breathing in to prepare. Exhale to float. Inhale to lower. Inhale, feeling that expansion all the way through your rib cage. Exhale. Good. And inhale to lower it back down. From here, we're going to come onto our hands and knees. And you're going to want to grab your weight. We're going to be doing a version of a bird dog, but adding a row with our arms. So I'm starting in this table position. I want my spine to be nice and long. I'm going to inhale to prepare. Exhale to reach and pull. Inhale to bring those limbs back to their start position. So again, we inhale to prepare, exhale, hug baby. Inhale to return. As you exhale and reach those limbs away, be thoughtful that your body doesn't shift side to side. We want it to stay centered. Inhale here, exhale. Another option here, if this is feeling available, is to add the leg lift from the floor if you would like a progression. So again, we exhale. Really think about your two grounded limbs anchoring into the floor as your other two move. Inhale, exhale. Good job. We're going to go ahead and switch the weight into the other hand. Inhaling to prepare. Exhale. To pull and reach. Inhale to lower back down. Be thoughtful that as you move those two limbs that your spine stays long. It's really common for people to round or to arch. We want to keep that completely flat as we move. Also check in that your supporting arm stays long. It's really common to bend the elbow or to shrug that shoulder up towards your earlobe. Keep that shoulder blade down your back, elbow nice and long, so that you can create more support through your core. Inhale at the bottom, exhale. Inhale to release. So for our final exercise, you're gonna want your yoga blocks or whatever stool substitute you wanna use. And then I'm using a chair here for balance support. You can also set yourself up near a wall as another option. So I'm gonna stand on my yoga blocks here, and I want you to really notice what happens here at my pelvis. So I call this the hip hike, and this is important for building more strength on either side of the pelvis. So we are going to glide this side of the pelvis down, and notice that my standing leg here stays straight. So it's really common to bend the knee in order to try to get that leg down. Keep this knee long as you glide. From here, now you're going to hike that hip up and really focus on this side of your hip, your outer glute, helping you to hike up and working to keep your spine tall as you do it. So it's really common to try to lean. We want to stay tall. Then you're going to glide that hip back down. Once again, focus on maintaining the tripod of your foot, big toe, pinky toe to heel, and knee straight. You're just gonna glide down as far as you can. I don't actually care if you touch the floor or not, but that's the motion. And then you're going to reach, get really tall, hike that hip as much as you can. And if possible, you can also hike even a little further by marching this knee up and getting even a little bit more of that work on this outer hip. As you access this, you're gonna feel your ability to access the inner portion of your standing foot. That's also what we wanna aim for. And then slowly lower and glide all the way back down. One more time here, we hike, add that leg march, get a little bit more, really push through your whole foot and especially that inner edge, and then release. We're gonna move that chair to the other side to work on the other leg. So starting tall here, we glide the right leg down, my left knee stays straight the whole time. Then I hike that hip up, bring that knee up if that's available, and hike that little bit more at the top and really feel that outer glute. Do that work and that connection onto the inner edge of your standing foot. Release that hip and then glide all the way back down. So as you do these, you're gonna start to notice often that there is one side that it's a lot harder to do this on. And that is a key to figuring out that muscle imbalance on each side of your pelvis that is often a big contributor to SI joint pain. So working on restoring the ability to glide the pelvis right and left is a really big piece of reducing SI joint discomfort. So we hike, reach, keep that standing leg long, keep your torso stacked long. Don't lean. Lengthening down, hike, last one, really reach, bringing it down with control. So I hope that you found these exercises to be helpful, and I would recommend exploring this series every other day for about 1 to 2 weeks to really build some more strength and help reduce that pain. And I would love to know what questions you have about SI joint discomfort, so feel free to drop those down in the comments below. And I look forward to catching you in the next video.